welcome everyone to Medscape. My name is Indu Subramanian. I am a neurologist here at UCLA and the West Los Angeles VA. I'm excited to interview Dr. Ali Saad today about a very important topic to all of us. It should be very near and dear. That is climate change. We as neurologists have to take a specific responsibility and role in caring about this as it impacts ourselves and our patients and all of us living today. So Ali, welcome. You have done neurology training. You're also a vascular neurologist by training, but you've also done a very interesting fellowship in climate and health policy, and you are actually affiliate faculty at the University of Colorado in their climate and health program. So welcome, and tell us a little bit about this fellowship, this specific training, and why you decided to pursue it.
Yes, thanks for the intro. I completed the fellowship last year at the University of Colorado. It's called the Climate and Health Policy Fellowship. It's been around for about 6 years, and it's designed to train physicians that have finished their traditional clinical training, meaning residency and clinical fellowship, on climate science, as well as the intersection between climate and health, and then how to be an effective advocate from a policy perspective. So it was a year-long fellowship. I stayed on as affiliate faculty. I'm the first neurologist to have done it. And my focus has been food systems' role between climate and health.
Did you do your vascular training before you did this fellowship or alongside, or how did that work?
Yes, I finished my residency in 2013, and then I finished my stroke fellowship in 2014. It was almost 10 years ago before I started the climate fellowship.
And what drove you to care about this area as a vascular neurologist?
Environmentalism has always been a personal interest of mine, totally divorced from medicine. But, after practicing for a while, I just felt I wasn't really providing my patients the best care because they'd come into the hospital with their strokes, and 90% of stroke risk is totally preventable from the traditional vascular risk factors. And that's an estimate from the Inner Stroke study, which was a large epidemiological study, but also from the Global Burden of Disease study, which the World Stroke Organization has used to create its own infographic. I can give people their statins and their aspirin and give them TPA and refer them for thrombectomy, but then I'm just sending them back into these environments where, it's these social determinants of health that are largely driving their stroke risk. And yes, people can make better choices, but they don't always have that option. And I think the factors that are beyond people's control for stroke, and a lot of the things we see in neurology, are the biggest contributors to their morbidity. And within traditional stroke neurology, nutrition has always been a big passion of mine because of its role in stroke prevention and the mitigation of metabolic syndrome. But the second biggest contributor to climate change outside of fossil fuel emissions and greenhouse gases, it's actually the food and agricultural sector. And when you look outside of climate change, food is the single largest modifiable risk factor for the majority of our chronic conditions. So I found food systems to be the perfect intersection between human and planetary health. And I found it really interesting, and I thought it would be a great focus of my passions outside of medicine, my passions within medicine.
And you just gave a talk at the AAN. How was that received? These social determinants of health seem very important to brain health in general. People in the cardiovascular space and many other disease states, cancer prevention and things like that, diabetes, they all seem to be decades ahead of us. It's interesting that you're the first fellow as a neurologist to go through this. The European Academy of Neurology has a task force on climate change, interestingly, and they're about to release, a paper about their, mission statement around this issue. So I think that people are rapidly realizing that this is something as neurologists that we should care about. What was one or two of the take-home messages of the talk that you gave at the AAN?
We divided into 3 bits. I did the first part giving a general intro to climate change, but then also how climate change affects health specifically. And I cited some meta-analyses and some review articles talking about the various mechanisms that are climate dependent that affect stroke risk, dementia, Parkinson's, various neurological diseases. And I think it was pretty well received. My takeaways are, number one, the things that are bad for the planet are also bad for our health, and more specifically our brain health. The mechanisms by which those happen, at least for which we have the largest amount of evidence for, are heat and air pollution. And they contribute significantly to neurological morbidity, at least with the World Stroke Organization. With their data, they quote 20% of global stroke risk can be attributed to air pollution, which seems like a crazy number, but that's largely driven by the disproportionate exposure that low to middle income countries have to air pollution compared to higher income countries, and their higher stroke risk and their larger populations. The last point is that there are things that neurologists can do, and there's things that we can do as physicians from an traditional advocacy perspective, like run for office, write to our senators, attend Neurology on the Hill. These are the traditional avenues, but I think people have to carve out the time to do that, and it's often perceived as asking something extra beyond your day job as a neurologist, which to some extent it is, and not everyone has the time or interest to do that, right? And so I think the way I like to approach advocacy, not just for climate, but from a health perspective, is to tie it into things that we're already doing. And that's where food comes in. And so, we can take these traditional advocacy approaches of, divesting from fossil fuels in our hospital systems, reducing single-use plastics. But I think something that is much more palatable to people and seems to have a more direct relation to health without having to get into the mechanisms of climate and health is promoting healthy diets for people. Because just by promoting healthy diets, that's not something that is political. It's not controversial. It's not something that any doctor or any neurologist is going to say like, well, that's not important. No one's going to doubt that diet is important for your health and, more specifically your brain health. In promoting diets for brain health, there are the direct brain health impacts, but there's also the climate co-benefits, because anywhere from 26 to 34% of our greenhouse gases produced globally can be attributed to our food sector. And the best way to reduce that emission footprint from the food sector is by embracing a diet that is minimally processed and not vegan or vegetarian necessarily, but just plant-rich. And this is what the American Heart Association now recommends. It's a plant-rich diet. More specifically, they state that most of your protein should be coming from plants, like legumes and beans and nuts. And, this is in line with the pattern of eating in the Mediterranean diet and the DASH diet and the MIND diet. So really just promoting that has these climate co-benefits without necessarily making it about the climate.
That's really important. So in a disease like Parkinson's, that's near and dear to my heart, we have aging populations of people living, in isolated places. And if there's a heat wave, these are the people that end up passing away. Very isolated people who are lonely. People don't even know that they live in their building. Can you comment a little bit on the effects just of heat in, for example, a neurodegenerative disease like Parkinson's?
So the best data we have for Parkinson's and environmental risk factors is more with air pollution, specifically particulate matter. So that's fine soot, basically, that you'll get from industrial pollution from cars. And that's associated with a higher incidence of Parkinson's. But something not specific to Parkinson's, as you mentioned, heat. It's something that will affect older people, people with any neurodegenerative disease. So we know that older people, when they get non-exertional hyperthermia, or they just get overheated, they don't necessarily manifest the symptoms of being overheated the way a younger person might. Their sweating might be impaired. It might just manifest as some nausea or a mild headache, pretty non-specifically. So they're overheating and they're not aware that they're overheating. And there's no one to pick up on these cues if they're living alone. They might just dismiss it and go to bed and get even more overheated. What happens in the summer is we'll have power outages. And so on top of it being hot to begin with, people will also have their power cut. And so now they've lost their AC and they're dehydrated. And so that makes them hyper viscous, which in turn increases their risk of ischemic stroke. So we see a lot of elders experience higher rates of hospital admissions for something as mild as dehydration, but they could come in with a heat stroke. They could come in with an actual ischemic or hemorrhagic stroke. They could come in with delirium triggered by being overheated and dehydrated. we don't have a validated tool saying that this has proven to be beneficial. But I think something that we should be doing, and something that I already do with my older patients, is, hey, summer's coming up. I'm going to take your phone and I'm going to set up an alert with your weather app, so that when it gets to a certain threshold, you're going to get an alert that says, hey, it's hot. Maybe you shouldn't go out between these hours. Make sure your AC is working. If not, maybe you should go to a mall or go to the movies or something, right? These are really easy things that we can implement with our patients that don't require any added cost. It's an alert. And often when we have our patients with neurodegenerative disease, we might talk to their family members, or they might accompany them to their clinic visits. And that's something that I can remind the family members, hey, if it's a hot day, there's a heat wave coming, you saw it on the news, you get an alert on your phone, check in on your elder, make sure that they are safe. And if they don't have AC, they don't have cold water, they have some kind of means to access those things, at least temporarily, until that risk goes away.
That's a great tip. I'm going to start using that right away, actually. Wow. Really low hanging fruit, some of these things, but can make a big impact. So, well, thank you so much, Ali. I really love talking to you and hearing about this area. It's been near and dear to my heart, and I haven't really known how to get involved and how to help, influence the behavior of my patients. So I think these are some great tips that you've given us, and really eye-opening. So thanks so much for joining us today.
Thank you.